No more waiting. Oh.
Many people over 65 or with underlying health conditions are demanding faster access to the COVID vaccine.
It's urgent because I have grandchildren, because I want to live.
And now that's what HHS Secretary Alex Azar is calling on states to do, saying the government will release all of its vaccine stockpile.
We are calling on our governors to now vaccinate people age 65 and over and under age 65 with a comorbidity.
But currently in Wisconsin, that group is listed as 1C and not in line for vaccine anytime soon. Do you anticipate changing that prioritization to move that 65 and over group up higher on the list?
The state will weigh in. They'll have their medical experts, their vaccine experts, their ethicists, their public health experts weigh in and decide what is going to work best for our state, with the end goal, of course, of getting vaccine to the people who need it as fast as possible.
The Wisconsin Department of Health Services tells 12 News decisions about eligible populations will be made shortly when we get more detail from the federal government about timing. And if they move you up on that list of priorities?
I'm going to be there in line, in front of the car, standing in line, bundled up in the cold. Whatever it takes, however long it takes, I'm going to be there.
And Kent, the Health and Human Services Department is also proposing a change in how the vaccine is distributed to states.
Yeah, that's right, Patrick. Those health officials in the Trump administration are telling states that beginning soon, the vaccine will be distributed to states based on the population of people over the age of 65 in those states and also how quickly the vaccine is being distributed. That will start in 2 weeks, but of course, by that time, the Biden administration will be in place with a vaccine plan of its own.